Hi, I am Mike Reed, and my presentation is on Doctors Without Borders. Doctors Without Borders is a nonprofit organization. They assist in the social issues through helping people worldwide where the assistance is needed greatest, delivering emergency medical aid to people affected by conflicts, epidemics, disasters, or exclusion from healthcare. You can see that Africa on this map receives 49% of the assistance from Doctors Without Borders. They fall into the exclusion from healthcare. They have assisted, Doctors Without Borders has assisted a lot with epidemics like cholera in Africa. But you can also see that also Asia receives a great deal of aid, followed by the Middle East and then the Americas. So as we learned, we can look at the impact of Doctors Without Borders in three categories: output, outcome, and impact. The outcome, outputs, we know that they do a lot of work everywhere, but just a few examples is that they created a burn unit in Port-au-Prince, Haiti. They do surgeries and set up hospitals in war zones like Syria and Afghanistan, where the local emergency or medical services may be down or has left the area because of the conflict. We also can recognize the vaccines and malnourishment that they assist with in Africa. Through the outcome, we can see that in 2016, we know that 9.7 million outpatient consults were conducted by Doctors Without Borders, and almost 700,000 patients were admitted, following which almost 93,000 major surgical interventions took place. So just by those statistics, we can see that they have a great impact on the medical world. But Doctors Without Borders, MFS, has pioneered and made many gains and led the way in international health. They started in the 1980s and have grown exponentially since then. Some of their struggles and accomplishments, as you can imagine, have come from the type of work that they do. There was an airstrike that hit Doctors Without Borders in a hospital in Afghanistan by U.S. forces. Unfortunately, in that situation, there was a hostile group that was near the hospital, and that hospital was collateral damage. In 1999, they received the Nobel Peace Prize, which is pretty impressive because Nobel Peace Prize typically goes to individuals and not necessarily organizations. So this is an accomplishment that few organizations are able to receive. Another example of a struggle that they have is a bombing in Sudan. Doctors Without Borders, they were treating some patients, and the hostile force that was opposing these patients went in and they bombed the hospital for that reason. And then also an accomplishment that they received was the Lasker Bloomberg Public Service Award, sustained and effective frontline response to health emergencies. So by way of improvement, in doing some research, I came across a blog put together by Sharon Ewing. She works for the Doctors Without Border in the administrative side of hiring, managing, and paying the staff that the medical team needed to operate and financing all the needs of the logistical team. She stated that there are 5 different desks that run the SF missions: Spain, France, Belgium, Switzerland, and Holland. All other countries fall under one of these 5. The US and Japan offices are part of the French desk. As you can imagine, each desk is run differently from the others in terms of hiring, training, practices, work/team philosophy. So my experience with French desk was entirely different than with the Belgians. One of the things that could really improve the MFS is through recruiting and retention of doctors and medical staff. They are hard people to come by because their salaries that they make while volunteering or working for the Doctors Without Borders is significantly reduced. And doctor makes about $50,000 a year compared to the $250,000 plus that they could be making in the civilian world. So it's important that everything be streamlined. People don't like change. So if room for improvement is that everything is streamlined so that everybody knows what to expect, regardless of what command or what desk they are working under. Another part of my recommendation for improvement also comes with recommendation for scaling. Retention of these physicians is important. And in Shannon's blog as well, she mentioned that there were numerous times in Haiti when riots a block or 2 away spilled across the neighborhood and spread around the city. When we didn't know if the armed riders running past the gates would try to storm the grounds, even team members were abducted. So if you're a physician and you hear that, you may not want to go volunteer for Doctors Without Borders. In my experience, I am a combat veteran. Security is very important, especially in third world countries. And if you've got a medical doctor in a third world country or a war-torn country, they need the protection. So in order to scale it, to increase the recruiting, security needs to be improved, and also streamline everything all together so that all the same desks work well together. Doctors Without Borders has done very well. They have high ratings with a lot of the websites that give recommendations for donating to a charity. They've received 4 stars out of 5 the last 6 years, I think I saw. That is my presentation.